There's nothing called an ideal way of doing a tummy tuck, but there are multiple ways of doing a tummy tuck procedure. The tummy tuck procedure has to be tailored according to the requirement, the condition of the patient and the need of the patient and the underlying pathology. The abdominal wall is good enough, then the patient may need just only removal of the excess amount of skin and reapproximation of the tissues. The second is, if there are no stretch marks, but there is a little bit of a protrusion, excessive amount of fat in the subcutaneous tissue, and the abdominal wall, the muscle structure is perfect, then a liposuction alone may be sufficient. But if the stretch marks are more, the overhang is more, then a liposuction alone may not be sufficient. So a liposuction in combination with removal of excessive amount of skin. When there is a gross overhang of tissue, then we may have to not only remove that excess amount of skin. When we remove the excess amount of skin, the umbilicus, which is also gets elongated and stretched, may have to be isolated and repositioned into a more natural position, which is called an umbilicoplasty with an abdominoplasty. This, in combination with liposuction, especially on the sides and on the upper abdomen, will give a good contour to the patient. Now, if there are multiple skin folds and there is also a widespread abdomen, then what is called a lis du fleur incision, that is an excision from the midline and removal of the excess amount of lower body fat and then approximation, which would then give an inverted T kind of an incision, may be necessary to narrow down the waist, correcting the abdominal hernia or divarication, reposition of the umbilicus, and bringing and doing a complete abdominal wall correction may be necessary. Sometimes there would be a mons ptosis, that is, in the crotch area, the excess amount of fat may be overhanging downwards, which also has to be lifted up along with the same while we do the same abdominal wall correction. So, an abdominal wall correction, correction of the hernia, reposition of the umbilicus, and a mons lift are all combined as one procedure. For those people who have had a bariatric procedure, have had massive weight loss, may require what is called a belt lipectomy, where an incision is given 360 degrees in the waistline like a belt. So that is called a belt lipectomy. So these are the different kinds of abdominal wall corrections, tummy tuck procedures that can be done. Another condition is when there is a very minimal amount of laxity of the lower abdomen post-pregnancy or post-weight loss, where we can do a minimal excision of the skin and tightening of the abdomen. That is called a mini tummy tuck. So these are all the different kinds of procedures, and each has to be tailored according to the need of the patient and the condition of the patient.